friends, how are you? Welcome to my YouTube channel D&D Pathshala. So, in today's video, I'll be discussing regarding the scabies and eczema, up to the risk factors and other types of the scabies and eczema. And in the next video, I'll be discussing regarding the scabies and eczema from the signs and symptoms to the non-pharmacological treatment. So, let's get started with our video. So first of all, what is the definition of the scabies and eczema? The scabies is a type of the dermatological type of disease that which is contagious. It can be spread and caused by a mite that which is known by the name of Sarcoptes scabiei, and it is a term that was previously used by the Romans to indicate any pruritic type of skin disease. So this pruritic type of skin disease means itching type of skin disease, and it can be easily spread through the close physical contact in the family or in the school or in the nursing homes or in the classes or in the child care homes. So these are the some of the areas that which through the close physical contact the scabies can be spread. Now coming to the eczema, eczema is also a type of common skin infection that which is characterized by the itchy and inflamed type of patches. So these are found on the skin, and it is also known as the atopic type of dermatitis. So coming to the eczema term, this eczema term came from the Greek word that is a boiling as tiny vesicles like bubbles on the early stages. So these are seen in the early stages of the disease. And what is this dermatitis term means? This dermatitis will be referred to as the inflammation that which can be seen on the starting layer, that is on the epidermal layer of the skin. So it will be acting as a broader type of term for the eczema. So these are the definition and some of the history regarding the scabies and the eczema. Now coming to the epidemiology regarding the prevalence and incidence of the disease in the people. In scabies, the mites are distributed worldwide and it affects all the races and all the socio-economic classes. Means it is not having any kind of racial discrimination or any kind of economic background. So it is affected to all the kinds of economic backgrounds and to all the races and in all the type of climates. And it is also having a greater type of spreading frequency in most of the seasons winter rather when compared with the summer, and higher rate of spread is also seen in the urban areas. And when coming to eczema, it is more common in the babies and the children of the 6 to 7 years age, and mostly it occurs on the face of the infants, and on the children it is mostly often appearing on the elbows and behind the knees, and also in the teenagers and also in the adults this eczema can be seen. Now coming to the etiology. So what is this etiology means? So what are the causes of the scabies and eczema? So as we all know that scabies is a contagious type of disease and it is caused by this mite name Sarcoptes scabiei, that which I have said in the previous first slide. So this is up to the scabies. But when coming to the eczema, the proper type of cause is not known. So it is mostly found that it is caused by a combination type of factors like due to genetics or due to the abnormal function of the immune system or due to the environment and the activities that which cause the skin to become more sensitive. So because of the more sensitive skin, the skin infections will be occurring more to the people. And if there are any kind of defects in the skin barrier, so because of the skin defects in the barrier side, it will be allowing the moisture out and it will allow the germs into the body. So moisture will be going away, germs will be coming into the body. And when coming to the scabies, it is transmitted by either direct type of skin contact or through sexual contact or indirect transfer by using that particular infected person's clothing, bedding or towels. And as most of the exposure is through the nursing homes, hospital institutions and etc. So the sites of the scabies inflammation will be mostly occurred at the scalp, face, neck and palms of the hand, soles of the feet. So these are some of the common areas. And based upon the endogenous and exogenous, means endogenous and exogenous are inside and outside factors. So eczema is caused, and some of the exogenous factors, that is the outside factors, are like irritants and any kind of allergens like pollen or such type of dust, photodermatitis condition. So these are some of the factors that which may cause this eczema. And most of this localization means what are the sites of these eczema means same when compared with scabies, face, neck, scalp, abdomen, such type of areas. So this is the diagram of the scabies worm or the scabies mite. So this big worm structure is the Sarcoptes scabiei. So this is the Sarcoptes scabiei mite. These small structures are their eggs. So these are some of their structures and these are some of their eggs. So when coming to the risk factors, the other type of the risk factors or the irritant factors that which can irritate the skin, which includes are dust, sand, perfume, soap and cleansers, makeup and its products, chlorine containing compounds, irritants in the environment. So this dust, sand, perfume, so many persons will not like the smell of the perfume. Means some of them will be using mild perfume, some of them will be using very high scented perfumes. But because of these perfumes also, some of them may get skin allergies, and because of soaps and cleansers, in some kind of products that which are used in the soap, they may be acting as the irritant factors, cigarette smokes and irritants in the environment, like I have said in the previous one, pollen and any kind of dust allergies. So these are some of the risk factors or the irritant factors that which can irritate the skin. So when coming to the types of eczema, according to the World Allergy Organization, eczema is classified into atopic dermatitis, allergic contact dermatitis, non-atopic, contact, occupational, discoid, diaper, gravitational, seborrheic, juvenile plantar, irritant contact dermatitis, napkin. So I'll be explaining these. So atopic dermatitis means it is an inflammatory condition with genetic, like immunological and environmental type of mechanisms. So it is mostly involved with the genetical or immunological type of mechanisms also. Now when coming to the allergic contact dermatitis means, so allergic contact dermatitis is an antigen type of substance, so which will be triggering the immunologic type of response, like at the time or sometimes even after several days. So these are the allergic type of contact dermatitis because of a substance. And non-atopic contact dermatitis means they have said because in the previous irritant factors. So because of such type of irritant factors or allergic sensitizers, inflammation may be caused. And occupational eczema, discoid means in the shape of discs type of. And diaper dermatitis means it is also known as the diaper rash. So mostly in the diaper rash, it is found in the acute type of inflammatory type dermatitis on the buttocks region or in the genitalia region. And also where through this diaper dermatitis will be mostly occurring either because of direct fecal contact or moisture contact in an unhealthy or in a bad type of environment. And seborrheic eczema means it will be mostly occurring to the upper part of the body. Juvenile plantar dermatosis, irritant contact dermatitis. So irritant contact dermatitis means, so these are being caused because of the organic substances that usually results as a reaction within few hours of exposure, napkin dermatitis. So these are some of the types of eczema. Now coming to the pathophysiology of the scabies. So what is the mite that will be causing scabies? Sarcoptes scabiei. So this mite will be producing this infection, I have said in the previous one, like either through direct contact or prolonged contact between the hosts. So this mite will be living on the non-living objects also, means viable means it will be on the living conditions on non-living objects also for about 2 to 5 days. So first of all, it will be transmitted either by the infected bedding or clothing, and these mites will be burrowing our skin within 2.5 minutes. So once it makes a burrow, so once it is on the host, then about 10 to 15 mites will meet on the surface of the skin, and after the mating completes, the male mite will be died. So after the mating process and after the death of the male mite, female mite will make the burrows in the skin's epidermis by using her jaws and her front legs. And the duration of this female mite is 30 to 60 days, and eggs hatch within 3 to 4 days. So an affected host will be having approximately 11 adult female mites during their infection period. So after this, larva will migrate to the skin surface in the short burrow pouches. So by making the short burrow like pouches, these pouches are also called as the molting pouches. So these will be present either in the skin or on the hair follicles. So they will be having three pairs of legs. They have three pairs of legs, and within 2 to 3 days they will turn into nymphs. They will have four pairs and they will become into adults after 4 weeks. So this is a type of life cycle. So how this mating process will be occurred means, male will be penetrating this molting pouch and that are formed by this female mite, and after the impregnation of the females they will extend their pouches into the burrows, means pouch will be changed into burrow by laying the eggs in it, and it will survive for about 1 to 2 months in the tunnels, so that which are made in our skin. So the, and also a type of delayed 4 type 4 type of hypersensitivity reaction occurs to these mites or their eggs. Skybala. Skybala means the packets of feces. So these will be occurring after the 30 days of the infection, and this type of reaction will be responsible for the intense type of pruritus. So this intense pruritus type of reaction is the hallmark of the disease. So this is the pathophysiology of the scabies. So this is the life cycle. So this is the mite and this is the adult female mite. So here these eggs are laid. So these eggs will be in a length of 0.10 to 0.15 mm in length. So after 2 days it is changed into larva. After 3 to 4 days this is the nymph, and after 4 to 7 days this is the adult female. So adult female will be of 0.30 to 0.45 mm in length, and after the adult male will be of 0.20 to 0.25 mm in length. So this is the complete type of life cycle. So this is the type of life cycle. So from the stratum corneum, the larva to nymph 1, nymph 3, nymph after the conversion, mating process, and this is the burrow, and these are the Skybella packets, and these are the eggs. So from these, this is the type of life cycle. So, and this is one of the life cycle process, and the transmission from a person to person by the bedding or by the clothing. This is given by the CDC. So here we can see here I and D. So I means infective stage and D means the diagnostic stage. So this is the life cycle picture. So coming to the pathophysiology of eczema. So pathophysiology of eczema is the first and most important step of this eczema pathophysiology is it is the exposure of the allergens. So by the exposure of the allergens, as long as the incomplete type of progression occurs, because of this genetic susceptibility by the IgE, that is the immunoglobulin E mediated type of hypersensitivity. In the scabies type 4 hypersensitivity reaction, but here IgE mediated hypersensitivity reaction, and to hyperactivity of the skin and the mucosa and this allergic disease, these are modulated, and also by these environmental factors. In this also the inflammatory mediators are involved. So a brief type of discussion regarding this hyperphysiology is pathophysiology, or the most of the other kind of reasons are like exposure will occur because of this hypothetical pathophysiology. So hypophysiology I said is the pathophysiology. So it is the exposure of allergens will occur. So because of incomplete progression, IgE mediated hypersensitivity and the hyperactivity of the skin and mucosa occur. So this allergic disease will be modulated also by the environmental factors. So some of the inflammatory mediators that which are involved in this disease are like leukotrienes, prostaglandins, cytokines, and these are also involved. So etc. type of inflammatory mediators that which are present are involved. And other kind of the neuropeptides and pruritus, which is also said as irritation. So because of this pruritus induced scratching will be occurred. So these are also the some of the factors that which may cause this pro-inflammatory cytokines from the keratinocytes. So this is some of the pathophysiology of the eczema. And T helper cells role is these are sometimes activated by the super antigens, like from the Staphylococcus aureus bacteria, that is the gram positive bacteria. So these are some of the pathophysiologies, and other factors like epidermal cytokines. So epidermal cytokines means these are also one of the type of cytokines. So the role in the eczema is they will help to produce spongiosis condition. So what is this spongiosis condition? Means intracellular edema. Means the abnormal type of fluid will be built up or the accumulation of the fluid in the epidermis will occur. So this is the spongiosis condition, and by their secretion also, by the secretion in the by the keratinocytes. So secretion by the keratinocytes that which are obtained by these T lymphocytes and irritants and the bacterial products. So some of the other stimuli, this spongiosis condition may also get developed. So this is the pathophysiology of the eczema. So this is a brief finding regarding the pathogenesis and the clinical findings. So this is the impaired epidermal barrier, innate immune system effects or defects, adaptive immune system defects, altered skin microbiome, so increased type of transepidermal water loss, impaired epidermal barrier. So because of this pruritus and excoriations. So xerosis effect, acute and chronic. So in the chronic, lichenification plaques. So here, so I have said in the previous one, spongiosis. So either it may turn into vesicles or papules. So by these papules it will disrupt the vesicles and it may ooze, dry scale or crust. So this is the acute atopic dermatitis and this is the chronic acute or chronic atopic dermatitis. So spongiosis condition if developed, then it will be showing the lichenification or the hyperkeratosis. So scales, and this is the IgE mediated. So immune dysregulation in acute and also in the chronic. So immune dysregulation is by IgE and in the chronic hyperkeratosis in the scale. And scale patches may also get formed. So this is the pathogenesis and clinical findings. So this is one of the immune mediated type of response, like here the interleukin 4, IgE class switching, and these are the TSLP, T2. So these are the type of factors that which are involving in the interleukin cytokines, and these are the impaired type of cornification by interleukin 22, interleukin 4, interleukin 13. So these are some of the different kind of factors. From the acute stage, so first of all from initiation, so these are the resident type of dendritic cells. So by the lipid synthesis abnormalities to the antigen type of, so this is the acute stage, and from here this is the chronic stage. Now coming to the stage of the eczema. There are actually three types of eczema: acute, subacute and chronic. So in acute stage of eczema, there will be distinct type of borders, so which will be appearing, and then the severity will be nothing in the acute type of stage. So first of all, distinct borders will be appeared. So as it is the starting stage, severity will be less, and in the case of this acute stage, blisters and spongiosis can be seen. So the spongiosis can be seen from the starting only. And in the subacute stage of the eczema or the stage of eczema, so it is also known as the transitional phase. It means it is translated from acute and chronic, means it is the middle stage. So here there will be less severity. So in this stage we can find a acanthosis condition. So here there is a acanthosis condition. So this acanthosis will be developed by interleukin 22 or interleukin 20 cytokines. So this is the stages of the eczema. So what is this acanthosis means? So an increased type of thickening of the stratum spinosum, that is the skin type of layers. So these will be found in the acanthosis condition. And in the hyperkeratosis condition, so hyperkeratosis means the stratum corneum layer will be thickened. So these can be seen. So these all are the changes that can be seen and found with the various kind of degrees of the vasodilation. So because of the various degrees of vasodilatation and also by the lymphocyte infiltration, so these all changes can be seen and found within the various degrees. Now coming to the chronic stage of the eczema means it will be long lasting and it takes up to 3 or more months to develop and appear the symptoms. So these are the different stages of eczema. So this is the healthy, this is the acute, and this is the subacute, and this is the chronic. So in the chronic, if you see, this is the hyperkeratosis. This layer is thickened. That is the stratum corneum. And this is the acanthosis. That is the stratum spinosum is also thickened. When compared here in the spinous layer, it is in a normal. But it is in this, means it is increased thickness. So, and here if you see, the leakage of the tissue fluids can also be observed, and these are the pustules appearance, and blisters can be also formed. So the zoomed type of image, so this is the normal skin. So here in this second stage, blisters can be formed and the fluid is filled in the area, white blood cells. So this is the third one, that is the skin rash can be observed, and the white blood cells will cause the swelling also. So, and in the chronic we can see irritation, rash, swelling. So this is the zoomed type of image. In the previous image I have shown you regarding the stages. So in this image, these are the different type of images like normal, blistered, rash and chronic. Now coming to the other types of eczema, there are actually two other types of eczemas, or so these are the eczemas that I have shown in the previous one. Now I am going to tell you regarding the other types of scabies. So there are actually two other types of scabies. Then they are Norwegian scabies and nodular scabies. So what is these Norwegian scabies and nodular scabies means? Actually in the year 1848, Norwegians Danielsen and Boeck. So these are the two persons' names, Norwegians Danielsen and Boeck, have actually described a very highly type of contagious scabies type. So this scabies was also found in the immune compromised patients. So in this immune compromised patients, this rare scabies was found, and it is a very high contagious, means it can be spread very easily in a very infective manner. And this rare scabies is occurred in the elders or in the mentally ill patients, and also it occurs due to a impaired type of antibody response. So this is the most of the cause, and because of this they can be infested with the mites in thousands, and also from thousands it can be also converted to couples of millions also. So this Norwegian scabies can be characterized by the lesions, scaly patches, mainly located on the hands, feet, scalp, and some of the pressure-bearing areas also. And the hyperkeratosis condition may mostly occur in these lesions also. And coming to the other types of scabies, that is the nodular scabies, as it is in a state of orange type of red nodules, that which is located in the axilla and in the groin, means on the upper parts also. So these are the regarding the other types of the scabies. So this image is the Norwegian scabies, and these are some of the orange type of reddish nodules, like I have said in the nodular type of scabies. So these are the two different types of scabies. So in this slide, I have discussed regarding the Norwegian scabies and nodular scabies, and that's it for this video. And on Sunday, I'll be explaining you regarding the signs and symptoms of the scabies, eczema, and from the signs and symptoms, I'll be explaining you the non-pharmacological treatment. So stay tuned, and thank you for listening to my presentation, and please like, share and subscribe to my video, and thank you.